So let's talk about your weight loss program and semaglutide, because that's one that's very, very popular. I get calls about it regularly. Tell us about that.
Yeah, so semaglutide is one of those peptides that is FDA approved. It actually started out in the dementia and neurology world because they noticed that it improved cognition. And then, it, as happens with drugs, they noticed, oh, this happens, and then that happens, and there's another side effect here. And so the side effect of semaglutide is that it increases, not the side effect, the action of semaglutide is it increases insulin secretion from the pancreas. Increases, which then increases glucose uptake, decreases insulin resistance, and so you have blood sugar modulation. That's another super important fact with peptides is peptides encourage your cells to do what they're meant to do. You can't regulate your immune system with it. You can't you don't up or down regulate with any peptide. You modulate. You bring it to homeostasis, which is your biologically happy place. So, and that's another reason why they're very safe, because I'm sure you can overdose on them and get a very vigorous response, but in a general, they're very safe with very few side effects because our body knows what to do with them. It's not a foreign substance. So then semaglutide increases the uptake of insulin, increases fat oxidation, fat burning. And by doing those two things, you get changes in body composition. I always say, man, I wish I could call it a body composition program instead of a weight loss program, but nobody would go for that. Everybody's fixated on the number on the scale.
I know. We're all about that weight loss number. We've talked about it over and over on our podcast. And, I will tell you, I'm guilty of it. I weighed this morning and I'm, starting my winter training. I'm at my winter weight, which is usually the heaviest I'm in.
Yeah.
And by spring, I want to be my racing weight. And so I weigh on that stupid scale.
Even you need to come down to Sculpt and do a Fit 3D body composition scan, okay? And that is what we look at.
Yeah.
Semaglutide is also very anti-inflammatory. There's an awesome study that it has anti-inflammatory effects in every organ system of your body. And so that is why it can help in the brain. I see people with intestinal inflammation lose 10 pounds of inflammation. It's incredible. Yeah. But without losing fat at all yet. The anti-inflammatory effects are quick. I've had patients with joint pain, knee pain, say it's gone, puffy faces, rings fit better. I mean, all of that stuff happens before the true fat loss happens. Yeah. And it's a great peptide for longevity, health, and I won't say anti-aging. It's not really anti-aging, but a graceful aging peptide. I plan on staying on it forever.
Anytime you can have something that decreases inflammation, I mean, it's going to decrease a lot of problems, including aging-related problems. Yeah. So on the body composition, instead of weight loss. So, what do you see with your patients as far as overall weight loss and body composition? Tell us some of the results there.
Expected weight loss studies. So there's 4 trials called the STEP trials that they did to get it FDA approved, semaglutide FDA approved, and available as the brand name. You guys will probably recognize it. Ozempic for type 2 diabetes, Rybelsus for type 2 diabetes. That's the oral form of semaglutide. And then Wegovy is the brand name that's FDA approved for weight loss. BMI of greater than 30 usually is what it takes, and comorbidities. And it is patented because, as you said earlier, it's the delivery system. It's the pen, it's the cell auto-injector. And so that's fine. But I'm still glad the compounding pharmacies can make it available to inject the good old-fashioned way. And so body composition, we're looking at about a 15% loss of body weight. And the time, I tell them all the time, it feels like a magic wand, but it's not. You still have to do the work. They've proven that you can lose weight without making any lifestyle changes. but it's very slow. It's very slow. And so when you're investing in a weight loss program, I encourage people to do all the things you can to get that composition, that weight loss happening quickly. And so I like my people to get up to about 4 to 6 pounds a month of weight loss. Some do more, of course, guys. If you have already a not huge, but an increase of muscle mass, of course, your metabolism is faster, so you'll lose faster. Changing dietary changes, of course, you cannot talk weight loss without prioritizing your protein, healthy fats, and vegetables. That works for most people. There is no perfect diet for every human on this earth. So I see all my weight loss clients once a month, and we have a big conversation about eating and moving, and try to adjust things to help them optimize their results. And so I think that's an important part of the program, is checking in, having a conversation with a trained professional that I've now worked with almost 200 people with this peptide. And so the advice and the insight is there. I have the experience. And so it's really fun to see people just change. It's pretty amazing.
Well, I have told people for many, many years now that the most dangerous thing that we can do as an American is to be overweight. In 2014, obesity-related disease passed up smoking as it killed more people than smoking. And that is not getting any better. So, and most of the obesity-related disease is from diabetes and cardiovascular disease. Most of it is when the deaths happen. And that's largely preventable. And
the disabilities, knee replacements, hip replacements.
Exactly.
Mobility. Look at how many scooters we have around the world these days.
Yeah, exactly. So Dr. Shawn Baker, he was on our podcast early on in our podcast, and you might recognize his name. He's the carnivore diet guy. Yeah.
He's now a Washingtonian too.
He is. Yeah. So you must follow him. Yeah. I'm not surprised you follow him. And anyway, here I am. I'm asking him. I'm like, as a pharmacist, I know that most medication that we take on a day-to-day basis in America, 80% of them are lifestyle-related diseases that if you lost weight and ate better and exercised, you wouldn't need them. Mm-hmm. So I had to ask him, I'm like, as an orthopedic surgeon, how many surgeries are unnecessary for orthopedic surgery? And, I thought as a pharmacist, maybe 35% are unnecessary. I realized the weight loss thing, like knees and hips and stuff, but he said 70%. Wow. 70% of surgeries are unnecessary if you change your lifestyle. So weight loss is part of that. Inflammation is part of that because it has to do with shoulder. He said shoulder surgeries. You change people's diet or change inflammation, and their shoulders aren't sore anymore. They don't need surgery.
Yeah. So Dr. William Seeds is the peptide guru that I train under, and he is an orthopedic surgeon too. And he does a lot with his clients and trying to avoid surgery. So he works with peptides and diet and inflammation and just optimizing that cellular function. It all goes back to the cell. If you have that cell optimized, operating properly, then you don't have aging, you don't have inflammation, you don't have pain, you don't have any of these degenerative conditions. So when cells don't have the information they need, then they behave badly. And then they influence their friends around them to behave badly. And that's when you get arthritis and anything. You get gut dysfunction, you get brain dysfunction. And so peptides are signaling molecules. What else is signaling molecules? Food, sunlight, sleep, exercise, all positive signaling molecules or not positive signaling molecules for our cells to behave badly or not. And so we want to get those rogue cells in control and and that's where fasting comes in, because when you fast, those cells that are not healthy don't survive. And so you get what is called autophagy. I'm sure you're familiar with that word. But autophagy is self-eating. Beautiful word. But it's cleaning up. Autophagy, self-eating.
It is what it is.
It is what it is. We want our bodies to get rid of those zombie cells, those rogue or unhealthy cells. And in every part of our body. That's why sleep is important, because we clean our brain at nighttime. We release growth hormone and testosterone at nighttime when we're sleeping.
Our muscles get stronger at night when we rest.
Absolutely.
Growth hormone when we work out. That's
Mhm.
I'm not saying we shouldn't work out, but if we don't recover, you will never get stronger.
Nope.
Sleep trumps it all. If you're
Yes.
not sleeping well and at least 8 hours a night, that's a problem.
It is a problem. And then getting at least 10 minutes of daylight every day in the morning. I tell my clients 10 before 10. So at least 10 minutes outside, even on a day like today when it's 31 degrees outside and there's a layer of ice on the deck. Get out there, take the dog for a walk, do something. And then that's also where peptides, we're talking about sleep and muscle. There's other peptides that are growth hormone, what we call secretagogues. So they encourage our brain to secrete growth hormone. And those are CJC 1295, ipamorelin, tesamorelin, sermorelin. So there's lots of peptides that we can use.
GHRP2, GHRP6.
Yep, the GHRPs,
right? Yep.
growth hormone releasing peptides.
Yeah, right.
There you got it. And so there's a whole, menu of those that we can go through and work with, increasing recovery and in that respect, when you're talking about growth hormone, that's like your master repair and building. And so there's a lot of things that can be improved with those. When I was trying to work out like my big buff husband, I hurt my shoulder and I was using BPC 157 and TB 500, which are both healing and anti-inflammatory. And I just even injecting it into the site, taking it orally, it just wouldn't go back to 100%. And so I started on a cycle of CJC 1295 and ipamorelin. And within 2 weeks, my shoulder pain was gone. So I was like, why did I not stack this together? That's when we can definitely stack different peptides to be synergistic.
Yeah, right.
And that's why it's important to get an informed provider to help you do that, because it can go wrong. And you can waste money. These aren't inexpensive. And so optimizing your results with your stacks and with what you're using is important. And preparing the terrain, that's always a good thing. Dr. C talks a lot about that with surgery, orthopedic surgeries especially. A lot of people use PRP or other anti-inflammatory injections before trying to avoid surgery. But if you're still have high blood sugar, if you're still highly inflamed, that is not going to be as effective as if you had prepared your body to properly use what you're providing to it. So we have to give those cells a happy environment to thrive.
Just like you're talking about with weight loss. I mean, you could give semaglutide alone and the patient may lose weight. But obviously if you move and you change your diet, and you're not just going to lose weight, but you're going to get better body composition and just feel better and look better. Mm-hmm. And let's face it, with weight loss, we can talk about using the numbers of body composition with your body fat. Mm-hmm. We could talk about using a scale, but let's face it. I'd say this all the time. The most important thing with weight loss, why does people want to lose weight? To look good.
Look good, yeah.
That's the only reason. Yeah. It has nothing to do with what the scale says. It does, but it doesn't. It's mm-hmm. a tool. It's important that, how you look. That's the important part. Do you want to look good in the mirror? That's what weight loss is.